Sioux First Nations Health Authority, or SLFNHA, presents SLFNHA Radio Connect, building strong connections with communities by sharing who we are, how we can help, and the services we offer. Wiindamekewinan, Sioux First Nations Health Authority Gajgadig, Egochke Eskam SLFNHA Ijankade. Miwa Kegunenan, Iwanun Kegunzwichi Guegban, Ima Ishkunaganang Kazgabeshig, Egochke Iwanun SLFNHA Wiindamekewinan. Greetings. My name is Charles Mikas, and I will be your host today. I currently work in the Wiindamekewinan department at Sioux First Nation Health Authority. And I'm originally from Sandy Lake First Nation. I've been with the organization now for about 8 years. Bozo wajigidna egama ngagakugajmawe oguma kegunenan iwenun akuzib mujiganan imanike Sioux First Nations Health Authority. Hello and welcome. Today we're talking about health partnerships and how engagement with communities is shaping better health care in Northwestern Ontario. We're joined by Megan Kendall, Supervisor of Engagement and Partnerships with the Sioux First Nation Health Authority, or SLFNHA for short. Megan, welcome to the show. Mira kchibuzu gidnuguna iwe nomga bizindamek, ego nomga gizgak, awe kagaganu namen kaganwabandang anin etujgadegen iwe kagogwe inawen jigenanung iwenun ishkunaganan ka hayagan iwe Kiiwetinoong. Ego awega Wiindamekewinan Megan Kendall Ijnikaz. Mima es yankwij ahi gajgadig Supervisor in Engagement and Partnerships with the Sioux First Nations Health Authority. Mima es ganwabandang iwe inawen jigewin anin gedujgadig ban keunj awashme kendawak kegunenan eyandawendamwaj ishkunaganan iwe Kiiwetinoong awaj. Miigwech ego ima Wiindamekewinan awe Megan Kendall.
Miigwech Charles, thank you for having me. It's a pleasure to be here today.
Thank you, Charles. Miigwech Wiindamekewinan Numenendan huma ehaya.
Let's jump into it. Where does engagement and partnerships fit into SLFNHA? Can you tell us about your team? Ego mima Wiindamekewinan kegunen iwe gajgadig engagement and partnerships. Iwe kagwe kenjgadig, kagwe awashme kenjgadig. Anin gegiz munuwidan khimdnanung ban awenog ishkunaganan kayawaji wed Kiiwetinoong. Wiindamekewinan kegunenan iwenun.
Engagement and Partnership falls under a new department called Strategic Policy Planning and Quality, or SPPQ, which helps to carry out our strategic plans. We make sure that everything we plan is guided by First Nations, including their voices in all of our work. Our SPPQ team works together with different groups and partners. We support our president and CEO, board of directors, and chiefs to make sure our work helps meet the goals and the needs of First Nations we serve. Our engagement team has a director, Bobby Christing, supervisor, myself, and 3 engagement and partnership coordinators, Joni Wesley, Reese Van Breda, and Joanna Henry. Each coordinator has 11 communities that falls under certain tribal councils. We are very excited to support this important work.
Naskagewen bina Wiindamekewinan Ziate oski anoki unachgewen esinkadik. Strategic Policy Planning and Quality Nanda SPPQ Ewi chiguyang chidodamang nendo nachgewen nenan Kechinach kakena ka onatoyang odakwa hanawa and Shininoak Kiiwetinoong Wiindamekewinan Wiindamekewinan SPPQ Wiindamekewinan 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 Kiiwetinoong Wiindamekewinan Wiindamekewinan Kiiwetinoong Wiindamekewinan Kiiwetinoong Noondihsiit anissinene ka anukkawangit. Naaskagewen anukkinaganak utokemamuan Bobby Christink. Supervisor Neen Mina Nissen Naaskagewen Mina Wiidamekewinan Oniganiskagek. Coordinators Joni Wesley, Reese Van Breda, Mina Joanne Henry. Kahkina Unigan Skagek, Pesikushab Apunan Okanawa Bandanawa. Mawach Nenchiken Damen, Che we Titoyang Howe.
Hello, I'm Lorna Fiddler, and I'm part of the Compliments and Complaints team here at SLFNHA. We're here to listen and to help your story be heard. At SLFNHA, we believe every story carries meaning. Your story, whether it's a kind word, a concern, or a suggestion, helps shape the care we give. That's why we offer a safe and respectful way to you to share your experience through our Compliments and Complaints program. You can tell your story in a way that feels right to you. You can speak in your traditional language or in English. We will make sure someone is there to listen and understand.
I know a big focus for SLFNHA right now is deepening engagement and strengthening partnerships with First Nations communities. Can you give us a sense of the background to that work? And why has it become such a priority now? Egamiwe Wiindamekewinan iwe mawaj ka kakchen khwadzgadig anin awashmege gunje Kenda Wachuban Kegunin Miami and the Windamwaj Awanug Ishunganan Kiiwetinoong Wedgayat Anin Kedudzgadig Gadawin the Mosnamna and Miam a Nankia Jaunug Kawidan Humada Egotske Anin we Eunjkin Dao.
Of course, over the past few years, it's become increasingly clear that meaningful engagement is the foundation for effective and culturally relevant care. Communities have diverse and evolving health priorities, and to support them properly, we need to listen deeply and work together. That's why we've been investing time and resources into meeting regularly with First Nation health partners and tribal council executives to understand their visions and priorities firsthand. Engagement in this context is more than consultation. It's about building relationships of trust, respect, and letting communities know we're listening.
It's a game. Utananga papeme akiwakin awashme ane paetenagwan kwayak naskage winning isi wagadate kemen sek mina si anisaniniwatak kanawen muwewen. Apewenak machine kanene mina emami squad stamakan utahkusuwinoa mina kwayak we chihinto peyatag chipisindawakwa mina chiwitan kimakwa. Mihuwe Monsha Gawanje Nakskawin Dwa First Nation Akuziwe Wiindamekewinan Mina Tribal Council Ogamak. Ewi Niejtamang Eze Bagsaban Damuaj Mina Ni Ganen Damuaj Chinun Dawangeto. Nazkagewan Ohuma Gai Chigadik Gawanehta Gagwetimuewan. So Unachigadekan Kiiwetinoong Che Onjima Gak De Bagene Mituin. Getene Mituin Mina Che Geken Damuaj Apuinak Epesentawangetor.
One of your main goals is to create a plan that helps First Nations work together and get better access to healthcare. Can you explain how SLFNHA is building that plan and why it is so important to include voices from every community? Wiindamekewinan kabizindamwaj aninwe wenjikchinen dawuk chimunu Wiindamekewinan Wiindamekewinan Awenug Ishkunganan Kiiwetinoong Gayawat. Egotske Wiindamekewinan Mayam Anekogwestigoad SLFNHA Iwen Jizazuzo Senung. Egotske Awenug Ishkunganan Kaun Jiwaj Getnaj Ubaksendamuanwa
Absolutely. The approach we're building aims to improve partnerships and creative collaborative solutions based on common priorities across the region. It's essential that the plans we develop are inclusive and shaped by the voices of First Nations at all levels. That means full engagement at the grassroots level, as well as regular and structured meetings where discussions and decisions can flow through our health leaders, from community up to regional leadership. Some of the goals including respecting and honoring First Nation voices, strengthening partnerships with tribal councils, identifying priority health areas collectively, and co-developing an engagement pathway that ensures community-driven decision-making guides all of our work. We're also working on communication strategy that keeps information flowing clearly between SLFNHA, the Chiefs Council on Health, tribal councils, and independent First Nations. We are receiving many requests from communities, and we hope to maintain that momentum at the community level, but also at the higher level with chiefs and health leaders.
Tētako, hiwe kāse anukātamang, kewenche wichiwe magak, chimen segen Wiindamekewinan, mina chimama wan kāteken ke inachigana wak, che untenagāteken Pesikwan is a seunan ansanikank. Kchineta kwan kakina awia. Chikekeninch mina otekitowenoa kapeyahi. Hiweka itikate kakina ansanina otekitowan mina mawachitunan mina kakwetimench awia. Ana pike bisach. Chitashin chikech mina. Wiindamekewinan ke onjasegen kedakusiwe ni ganihtamageminanak ansininikangapen ni ganihtamagewinan anda kakwe tipenamak kayeche ketenemento mina Chikichinenemento ansininuag utkitunuan chimashkawatek Wiindamekewinan Tribal Council kank mamo chuwinen chikatek ni kan anukatek ahkusuan mina mamo che onachikatek keni se kekenench ansinina ketsinach Utenenta moen chiapatak unachikanuang. Nintannukkaataamen kai kanuunuwewen kewenche payahte pemosseemagak nasawiyahi Sioux First Nation Health Authority Chiefs Committee on Health Tribal Councils mina ka papishigopits apuwin nimpik ka kanuunukomen mishinwa apuwinak mina nimpagossenemekomen hiwe chise chikenta moach anshinoak wetikaye spiming okemakan kank mina akusiwe ni kanishtamakik.
That is a lot of amazing work, Megan. When you talk about community engagement, what does that actually look like? Mira Marjugamun Nawa Niwa and Kiwan, Megan. Gadawin de Mosnamna Anin Ekogwestrinanung Yua Osme Jugawekenzradeg Karagwedjamanda Ishkunganangau Juads Wed Kiiwetinoong Anin Endamaj Anin Gegunj Wichin Darban and Aniwes Nagok Yua and Kiwan.
Great question, Charles. Community engagement happens in many ways. We host in-person and virtual meetings, focus groups, surveys, and by having one-on-one discussions. Over the past year, our president and CEO has had 4 meetings with First Nation health partners, who are the Tribal Council executives, many meetings with Anishinaabe Nation, NAN, our government partners, and many others. Our engagement and partnerships team also held 8 meetings with independent and Tribal Council health directors. We've presented at the Health and Nursing Directors meeting in February and at the Chibougamau First Nations Tribal Council Health Directors meeting in March. These sessions introduced our team and gathered direction on creating a health directors network and an understanding engagement and health priorities.
Kstiminuga Apewin nan skagewin machinoek tutigate. Netantawe wapamamen ezayank mina biwap kong nentunche nagska wamen. Machina uyak ka ohkotasin tigewat kakwetua upeban kaya batak mina auya kapapes go kakanunch. Otananga akiwak. Ndokema menan niwa uki naskawan anshenenuan ka akusi Wiindamekewinan Tribal Council Ogaman. Mishinwa uki naskawan nan. Okema ka Wiindamekewinan mina mishina wiyak. Nenazakagewen mina Wiindamekewinan Anoki na kananak uki na kiskawawa na soswa kape sigopit apuin mina Tribal Council akuzi okima ninki debatsmamen health mina nursing directors mawaj hituin February mina Chibougamau First Nation Tribal Council Akusiu kemak mawachituin March. Mihuma kagi winento netan kinagan nanak. Mina nagi ontanamen kase pagosene moach se onatenek. Akusiu okemak Wiindamekewinan. Mina chen sidutang Nazkagewen mina ka ni ka ne chika taken akusiwe wichiwewenan.
That's impressive. A lot of engagement happening on multiple levels. Miwa Marjugamun Nawan, Marje Exjenhuinanung, Iwe Osmekagwekenzradeg, Iwe Akuziwan Huanga Mujradeg. So Kenzradeg anin gegis wichin daban ishkanranang wedgaun juad jahing Kiiwetinoong.
Yes, and to support this, we've developed a draft community engagement pathway and a draft engagement partnership strategy, both of which are in the process of being validated and endorsed by First Nation partners.
ეხა 호에tas 주위지가 바위스지가데크 능기 오나토멘 네스타모스비간 게니시 빈트게양 아베원 나스카게원 미나 네스탐 오즈비간 나스카게원 미나 위단르키미토원 호에노완 니신 메과츠 나나가츠지가데원 미나 제마스나 호트스와츠 안신니와 위단르키마가낙.
How are you keeping the broader community informed about all of these initiatives? Anin etujgadig, anin eshchigayeg, chigi kendamwaj kakana iwed Kiiwetinoong kayawaj anshinwag anshinabeg iwenun jikendamwaj antquiwen iwe akwazi antquiwen kab mujgadig kegunenan Eabetstuyeg Wiindamekewinan jikendamwaj iwenun gayen khwajgadin.
In collaboration with SLFNHA Communications, we're launching monthly SLFNHA updates on Wawatay Radio, so make sure you tune in every first Monday of the month at 1 p.m. Central Standard Time. We're also active at community events. For example, our team took part in the Mishki-Gogaming Health Hub grand opening and had a booth at the Kingfisher Health Fair, along with booths at broomball and hockey tournaments. These are all part of a broader goal to stay connected, accessible, and transparent with communities.
Wiindamekewinan Sulakaut First Nations Health Authority Communications. Jama in Nemadstormen Tasukizes, Chittabachumyang Wawatay Nanstamoning. Nistam gan Kiugisugag Tasukizes basic is a sage. Nintashamen Gaye Nanda Inakamagak Abuning. And Danuki Naganananak Ki Isawag Mishki-Gogamang Akusiwagamik Chibakanagewin Mina Nigi Unatomen Ndayananan Kingfisher Health Fair Gaye Nigi Unachigamen Broomball Mina Hockey Maune Hudonan Mi Huenwan Gadodamang Chunjik Kenemegoyang
Great. With that being said, how do you define successful engagement? Ego miwa majugo menwashin. Ego iwe gakanaga gikidien. Ani ngegunj nisdaw na wakuban iwe a seg iwe ankyun a seg nun down da kaz kagwedaj kaz anam seaj anshinwage go anshnabeg Kiiwetinoong gayat.
Successful engagement is when community members feel heard, respected, and see their input reflected in programs and services. It's not a one-time consultation. It's an ongoing relationship that builds trust over time. Our team is dedicated to keeping those connections strong, making sure voices continue to guide the work we do, and ensuring that all plans and services truly reflect what communities need and want.
Gamen sek naskagewin, mihima esinagwak, anshin nagainin dank, non dawinch. Ek tenemens mina ehwabantang utkidowin ehabatanenik, wichiwewinik, Mina Ankiwanang. Gawaneta Pesqua Kanochigewin. Mipuko Asia Pemosema Gak Wichi Witowin. Apintas Te Pakene Mitowin Tane Onchimagan. Nintano Kiminanak Kishinach Wichi Witowin Oga Anokatanawa Chi Mashkawisink. Kishinach Kadonan Chitakahike Magakin Anokiwinink Kadodamak. Kishinach Kakina Onachigewinan Mina Wiindamekewinan Wiindamekewinan
Megan, before we wrap up, is there anything you'd like to ask of our listeners today? Megan, egwa iwe minuke ska isegima kaga gediak. Kegun kwi kagwejmag kakanaga bizndamwaj nomwa gizgak kakanaga bizndamwaj ahing Kiiwetinoong gayawat.
Yes, our engagement and partnerships team is dedicated to building strong relationships, and we would love to hear from you. Please reach out and share what you'd like to see in your community, or let us know if you have any upcoming health events you'd like us to take part in. You can email us at engagement@slfna.com. We're here to listen and connect. Miigwech Charles for having me on the show today.
ʻEha, naaskagewen mina Wiindamekewinan Nentanuhkinagan nanak utanuhkatanawa chimaskawanik Kiiwetinoong mina nenta menuentamen pekanunsiang pekanunsinam kekunen entawentaman kitabuning nanta Wiindamausinam wais chikewekwen ahkusi wichikeweneng uncha Damen sigi Kiiwetinoong Bimasna Motionam engagement@slfna.com Kikapisandagonawa Mina Kiiwetinoong. Thank you, Charles. Omaga Bewita Bimshian Nongum Gagizgag.
Miigwech, Megan, thank you for sharing your time and insights today. Today we've heard how SLFNHA is deepening partnerships and strengthening community engagement to improve healthcare access and coordination across the region. Through regular collaboration with tribal councils, health directors, and communities, they're ensuring First Nations voices guide every step of the way. From new engagement strategies to regular communication updates, and a focus on community-driven decision-making, it's clear that authentic relationships and shared leadership are at the heart of this work. Kichimigwechkingu, Megan. Kaisegima Wiindamekewinan Wiindamawada Kiiwetinoong gayawaj Kiiwetinoong anin pianhuaj anin eschigaj iwanun ketchnaj nundawunda ahag Anshinwagego Anshinabe Kiiwetinoong gayawaj Mawaj SLFNHA ekchien khwadang Mawaj ekidwaj adgage Wiindamekewinan ahan ahag tribal councils ʻīhtsʻ taʻmaʻīg agotske healthcare directors ahing ishkungananga unjuaj miwe maojuga emenosing iwenun maojikadwaj Wiindamekewinan da agotske jkenjga degen anin ezianum sewajiwe ahi akuziwan kyun gab mujgadik maojianamak agotske anin ishchigwaj chigi kakogwedewaj ahing an mayame seg ahing ishkunganung Kiiwetinoong miwe miigwechkidnugu agotske maojugud jimun Wiindamekewinan miwe maoj is a book since gadege ein tago Kiiwetinoong gab mujgadik miwe kchimiigwechkidnugu miwe. So that concludes today's show. Thank you for tuning in to SLFNHA Radio Connect, where we are building strong connections with communities by sharing who we are, how we can help, and the services we offer. Connect with SLFNHA on our Facebook page or on our website at www.slfna.com. Miapnugiwe etibseg nuum imaga Wiindamaguyeg Akuzio and Kyun Gab Mujgadik. ima SLFNHA Radio Connect. Mawajibu Iehetanong Ishunganan Wiindamekewinan da Anshinwagega Anshinabeg Egotske Anin Gegizwichigu Emban Iwa Akuzio Ankun Gabmujgadek Migat.
Recorded and produced at Wawatay Communications Society.